Hi, Rajinder. Welcome to Struggle to Strength.
Hi, Mary Beth. Thank you for having me.
Well, it's a pleasure to have you here. I'm just going to quickly introduce myself. My name is Mary Beth Simone, and I am the founder of Niche Partnership Consulting. And my business was born out of a personal struggle, which turned into a strength. And through this platform, I like to share the struggle to strength stories of my guests in hopes that it will help you connect the dots to your struggle to strength story. Rajinder, today we're going to focus our conversation on how you found strength by dropping your superhero cape. And before we dive in, can you tell us a little bit about your background and your business?
Yeah, thank you. So by profession, I'm a pharmacist, working in the community. I've actually been a pharmacist now almost close to 3 decades. I have my own brick and mortar pharmacies, and I've actually been working very closely with women as a compounding pharmacist. So I've always been exposed to women seeking alternative care. As compounding pharmacists, we compound the different hormones that women use as part of the treatment for some of the symptoms they may have in menopause. And to be really honest, I never really understood what women, were talking about at the time. I was, in my 20s when I started. And up until probably just a few years ago, I didn't really appreciate what they were going through and what they meant by having clarity, when they would pick up the medications or when they were out of it and having symptoms and so forth. And so really life events kind of brought my personal and my professional life kind of colliding. And that's kind of like what has brought me to where I am today. So I feel like the universe always has messages or almost like pivots that it wants you to do, but we're so consumed in our day to day or almost on autopilot that we don't realize that these messages are there for us to like take a moment and stop and pause. And I've had 3 different incidences in my life that happened, but really the most recent one was when my daughter was diagnosed with Hodgkin's lymphoma at 18. And here I was thinking I'm going to be an empty nester. What am I going to do with my time? I was trying to figure out what's the next stage of my career. Having my own pharmacy, I've always been able to, do a lot of different clinical services and add different programs, but there was always something else that I wanted to do. So I was already starting to look about what is the next steps for me professionally. And so when my daughter was diagnosed, as a mom, even as a pharmacist, I really felt like I failed. I didn't understand where this came from. She was healthy. I felt like we've done, all of the preventative things that you could, making sure she has her wellness checks and so forth. Didn't realize where this came from. And prior to that, I myself at like 37 was walking around with blood clots, and I didn't even know it. And my body could have been sending me signals. I didn't listen. I just, randomly went for an appointment somehow, by, God's will that I ended up at a doctor's office just for a checkup, and they were discovered. But I never really asked why. I got the treatment, thank God. I was diagnosed, taken care of, and this happened on a Friday. Monday, I wanted to be back at work. Similarly, my dad had chronic heart conditions, and so he's always been in and out of under a doctor's care, in the hospital, having surgeries. And when he had to have heart surgery, and then there was complications, and unfortunately he passed away from those complications, I left it to, he had chronic. I never asked why again. I assumed, it was a chronic conditions. And again, I threw myself back into work, and it was a way of me coping. But it was not, I never really dealt with it. And then when it came to my daughter's um, health crisis, she was the one that asked why. I remember the day we were in the room, and the doctor comes in to talk about the treatment, that this is the regimen they're going to use. She's 18, she's petite, and as it is, she looks younger than her age. And the doctor just looks right over her and is talking to my husband and myself to let us know this is what we're going to do, and basically dictate the diagnosis and the treatment plan. And all of a sudden we hear, why? And when my daughter, verbalized that, it just hit me, like, all of the times that I'm a pharmacist, that I may have been talking to my own patients, and how I'm just dictating information to them, and I'm just telling them what they can do, but I'm never addressing the why. I never really went into, like, why this was happening, why they need to take the medications, and so forth. It's, as a pharmacist, I stayed in my lane. I felt like, I've been a great pharmacist. I've helped people along the way, but I've always stayed in that lane according to what are, my duties and what the doctor's duties are, and I never crossed that bridge. But when my daughter asked that question, then I realized, well, why did I never ask why? When I fell ill, or when my dad was having these chronic conditions, why did I never ask? Why did I just, accept what was given to me or told to me? And so as she went through her treatment, which was about 6 months or so, and she was going on her journey of going through chemo and dealing with all of these changes and her own mental health, I myself was start questioning things as well. And so it was after her treatment, which now, knock on wood, everything is fine, that I started to really start thinking about where I was going and what I was contributing, you know, personally and professionally as well too. And so I started to look into functional medicine, which I kind of just fell into as well too, when I was looking for different alternative treatments or ways to help my daughter stay healthy. And with functional medicine, it's getting to the root cause of your symptoms. And so it's not just, you having a symptom and then getting a treatment for it. It's really trying to understand why you're having those symptoms in the first place. What part of your body is not connecting, or what system is not functioning properly. So I really fell in love with that. And so I decided to do more training with Institute of Functional Medicine. Then I wanted to even further and started a fellowship with the American Academy of Anti-Aging. So I felt like I needed more information on this. And then that basically has led me to create, my wellness company, Sunrise Health. And that was to bring more of a holistic approach to the way, we see ourselves, as far as treatment for women, and then kind of like bridge that gap between conventional, traditional medicine that I've, been doing for over 2, 3 decades, and bringing in this more of a holistic approach. And so it really was that, moment of me like having a different view, like being from you know, out of the, counter, behind the counter, to flipping to the other side as a patient, as a daughter, as a mom, to realize what's going on the other side, and what is it that it's not information that people just need. They also need the why underlying reason, and also almost like that empathy of what's happening, and recognizing and acknowledging, like a moment of, like, to stop and pause, to like process everything that's happening. And I think that's one thing that I never did, is stop and process things, whether it's going from school to getting a job to getting married to having kids, dealing with businesses, everything that's thrown at us as women. We just really don't stop.
Yeah, so that is such a powerful story, Rajinder. Like the way that your personal life evolved and these challenges arose, and then it took your professional life in a different
Mhm.
direction, like helped to expand your view of your practice. So, can you tell us, where is your brick and mortar?
My brick and mortar pharmacies, I'm in California, so we are about an hour north of Los Angeles, and so we have been evolving even the brick and mortars now that I've been exposed to this more holistic approach. So even within our own pharmacies, we've added more wellness, kind of like more niching down into the specific needs of the demographics that we're serving, instead of, again, just being in that lane of giving a product of the medication. So it's been an evolution, not just like for myself, but also for the brick and mortar business. And then on the parallel, having the wellness practice, which is completely separate. It's like taking off my pharmacist hat and putting on more of a coaching mentor hat. In fact, the functional medicine, which I thought again was going to give me the answers to help find solutions for my patients, I still felt wasn't enough. And so I realized that as I was evolving and I was questioning more things, I needed more um, guidance myself. And so I have done a women centric coaching program where then it's taught me more to go more into my feminine energy and my intuition, which I think um, we as women, when we take on so many roles, we kind of um, I don't want to say suppress, but it goes down on the lane. You're more into strategy, getting things done, to-do lists, getting out there and just accomplishing and conquering and so forth. And you almost have to be in your masculine energy in order to get all those things done. And so I think that's what I found, even working with different women, is that we don't have time. It didn't matter what stage of life women were in that I was working with. I had all this information to share with them. I was so excited about this new gained knowledge, but I still wasn't resonating somehow. And I realized it's the time. Like, how do we as women give ourselves time? And that's where I had to figure out what are those inner barriers that we have that's not allowing us to put ourselves first. I mean, we know we have to be healthy. We know we should be exercising, having movement. We know we should have self care. But what is stopping us from actually taking action and, taking care of ourselves? And I realized it really is, we need to just stop doing and we need to be. And we need to create that space and give ourselves permission to just, you know, be. And that's kind of really how everything has evolved for me now.
Yeah. Um, so, can you share with us what was going on in your personal life and professional life when you realized that you were sacrificing your well being to fulfill your roles and responsibilities?
Yeah, it's really kind of like one of those deja vu surreal moments. My daughter had just finished her treatments, and as a mom, you're relieved that everything was had gone well, and she's doing well. And but I was walking past the mirror, and I just, like corner of your eye, I caught myself, and I realized I didn't recognize who this person was. And as simple as that may sound, it just like put a light in me. Like, I don't know myself. Who is this person? And it took me back to actually something my son said the day that my daughter was admitted at the hospital. I refused to kind of leave the room. I didn't want to go have, take a break. I didn't want to go eat anything. I didn't want to leave her side for even a moment. And my son goes to me, Mom, you don't have to be the hero all the time. And at that time, I was so angry with him. I was like, how can he say that? Does he not understand what I'm doing? I do so much. I'm here. I want to protect, my daughter. And I was really angry with him at that moment. And for some reason, his words like hit me that day. And I realized I don't need to be the hero. I really don't need to be always running. Running, like there's, when you're running a business, you feel like there's a competition, you're in competition with something, or you feel like you're on the hamster wheel and you're numb and you're burnt out, or you're always putting out fires. And that's what I felt like I've done all my life, is I was that person that went and put fires out, because that's all I knew. I put my value, um, was like my productivity. Like if I wasn't doing something, I wasn't valuable. And it's, I can have this conversation now, but at that moment there was just a lot of turmoil going on. And so it just started to evoke questions in me. And to be honest, I think, after my dad's passing, I had withdrawn from my own spiritual, self, and was probably a little more angry than, that I didn't realize that I was holding on to so much anger. So when I started to notice how I looked, I started to pay attention to my physical health and started to think about, okay, I had gained 30 pounds over the course of my daughter's treatment, and I didn't even realize it. Like, you see yourself every day, but you don't realize all these changes have happened to you. I wasn't sleeping. I didn't value, that the importance of sleep. What I was eating often was just whatever I would grab. I wasn't paying attention to that. And so when I started to pay attention to my nutrition, what I was consuming, how I was sleeping, adding movement, and then also realizing that there are certain things that, just because they worked before, they're not working now. I needed to kind of be more attuned to what my body was saying. I gave myself that space to learn about what was working for me and what wasn't. Then automatically, I went from coming home being exhausted, watching TV just to zone out, to having more energy where I wanted to learn more. And that's when I started to do all these different programs. My, podcasts I was listening to were different. So all of the consumption of information changed as well. And then I started to become more grounded and start spending more time in nature, which I think evoked that spiritual aspect in me again. And then automatically my thoughts started changing, my actions started changing, and where I was spending my energy also changed. So it was just like an evolution that just kind of happened one step after the other without me even thinking about it. And it all started with me taking a moment and really looking at what I was doing and where I was in my life.
Yeah, so it sounds like it was like the weight and body image that really got your attention and then helped you to move down towards this path, taking this path,
Mhm.
this new path. And then where were you in this whole process when I met you in the Thought Leader Collective?
I think I was still in the beginning because I knew that, so this was, I believe it was November of 2020, I
I
think.
think so.
Yeah.
Yeah.
So my daughter had already finished her treatment earlier in the year, and I knew I wanted to now, start this wellness, path, and shift my career into helping, people be healthier lifestyle wise. And I think I was still in my clinical mode at that time, where I still was like, I have so much information. I need to gather information, regurgitate that information to clients. And so, although the Thought Leader, Academy helped me start, thinking about my story, start verbalizing everything that happened, I believe that's where I kind of really understood about the message the universe was sending me. I never, prior to that, I never sat down and chronologized all of the events that happened to me. Things happen and you just move on. That's what I've always been taught, is you get up, you fall down, you get up, move on. And then after, getting going through the academy, I started to get a little more active on LinkedIn, which I think helped to get me out of my comfort zone of being visible and showing up. I didn't really have a theme or content. It was like, okay, this is what I'm feeling today, and I posted, and it just kind of evolved from there, where what I was posting started resonating with people, and then the more that people engaged, the more I got comfortable starting to share my story. And I think it just really evolved from there. But that being in the academy and having to go deeper, and instead of just saying, okay, I want to help women, but how do you want to help women, and why do you want to help women, and why, how did you get here, and evolving that story was really helpful as the seed to start you know taking this journey.
And I'm curious what your process of self reflection looked like, and if you shared with anyone that you were going through this process.
I think, like I mentioned before, it happened pretty organically, because for me, the first thing that I noticed was that my physical health, I didn't like the way I looked. I had gained the weight, my skin was scaly, I just didn't feel like myself. And I looked tired. And so once I started with, the physical health, and then everything else kind of fell into place, where I realized that I need to start paying attention to myself. And people started paying attention to me, like organically. And
Yeah.
so when I would, people, again, when I would post, I would get messages that, this was very inspiring. This is exactly what I needed to hear. That this resonates with me. When I do different talks or presentations, people again are inspired. But what really, really solidified everything is that they feel something different with me. I'm showing up differently. That where I was a reactive person before, like, because I was always on that fight or flight mode. I'm that one, to go in and clean up. I'm that go-to to put out the fire. I was always ready to swoop in, like, have my cape, have everything on, ready to handle things. And I am now much more at peace, but more resilient than I ever was, because now I've become more attuned to my inner self, and I have security and safety within myself. And so I show up as I am, you know, I authentically. And I think people can resonate with that. And so I think that that energy exchange is what I'm feeling, or getting the feedback from, is that, it's not like, it's a different kind of intensity. It's not like where I'm on edge, always worried about things, and versus they feel calmness, which somebody really pointed out to me, I think a couple of days before my birthday, and I was like, wow, I never really realized that. And it was like a really nice compliment to hear somebody give me that kind of feedback.
Yeah. Yeah. And so, Rajinder, what type of advice would you give a businesswoman who feels like she is sacrificing her well being to fulfill her roles and responsibilities?
Um, the first thing is, like I said, stop running. Right? We're running to do so much, whether it's you're running that you feel you're not enough, so you're always trying to stay ahead. You're running because you're trying to do the grind. You're on that hamster wheel, and you just want to work, 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 because you're trying to accomplish something. And lastly, you don't want to keep running to put things out all the time. You don't have to be the one to shield, um, other people, or your shield your business, and you put yourself, you know, in the in the light, so that you're absorbing all of that shock. Most businesses now are getting started by women in their, midlife, late 40s, 50s. So you have to acknowledge that you physiologically are changing as a woman, and there's things that your body is going through that you need to also address. You're your biggest asset. So putting the time in and investing in yourself is the best thing you can do for your business. And that could be professional growth as well as personal growth. And that personal growth could be, you know, just learning to find little joys. Instead of just thinking about strategy for business, you have to think about your own well-being, and that should be top of mind. um, you know i I've pretty much been an entrepreneur since the beginning of my professional career, and I feel like I created a great business, but I never put myself in the equation. I boxed myself in. So my business was um, on me. So if I couldn't take myself out of the business in order for the business to still succeed. And so now the way I'm envisioning my wellness business is more of how I want my business to be, how I want to show up, and the types of clients I want to work with, versus the other business was built on scarcity, where I didn't feel good enough. I was, in the fear of failure, that I needed to do extra and overcompensate for things. Whereas now, knowing who I am and being secure in who I am, I feel like I can show up and create the business that I want to show up for, versus, being in a business that I feel like I have to do.
And I think that that sentiment resonates with so many people, men and women, like anyone who has created a business, I think can relate to what you're sharing there.
Yeah, thank you.
So just a couple minutes left. I think it's a good time to switch gears and hear a little bit more about your business and what you're focused on now, and if you're promoting anything in your business.
Yeah, thank you. Yeah, so actually, again, like I said, this whole journey for me has been an evolution. I started out knowing I want to help clients in general, men and women, is what I started out with. Live better, healthier lives, and not just rely on a quick fix. And the pill is not the end all be all. There's time and place for treatments, but taking responsibility and ownership of their health. But I realized what people really need is the guidance to learn to pause. And so I created a signature framework called Pause. And so we have two phases where the first 12 weeks is really about your physical well-being, to learn everything that you need to gain the power to become aligned with yourself, to unravel the things that don't work for you, to create that space for self, and then embrace who you are in order to be authentic. And I think people really forget the importance of creating that self-nurturing relationship. And that's what this program is about, is to take you through your physical well-being, tapping then into the second phase is more of the getting into your own intuition and feminine energy, and creating that purpose in your life, which then again encompasses your mental health as well too. So it's a holistic approach of mind, body, and soul, so that you can show up, use this opportunity in midlife not as a crisis, but a moment to pause, to realign yourself and create that next chapter in your life.
That's wonderful. And what is the best way for people to connect with you if they're interested in joining the program?
Yeah, LinkedIn is, if follow me on LinkedIn, we will be doing more promotions and opening up in November for our January cohort. If you can DM me directly, or send a message off of this link, I'd be more than happy to connect. We do have a weekly newsletter that we have. You can sign up for that. So as new information, I always like to do midlife reflections and give scientific based information on what's going on physically, physiologically, but then also relate it to everyday life as well, and then add my own personal stories to it as well.
That's wonderful. Well, thank you for being on the show today, Rajinder. I really appreciate you sharing your story.
Thank you for having me.